interRAI itself is a collaborative network of researchers, and it pairs across 35 different countries. And what they do is they develop instruments that are well validated, and they collect high quality data on vulnerable populations. And what they do is they develop an assessment to intervention system from 0 all the way up to geriatric populations. So what we're doing is we are creating the 0 to 3 assessment system to complete the suite, so that we get a full-scale lifespan approach. Specifically, the 0 to 3 is meant to capture the mental health and developmental needs of very young children, so that it can forestall any sort of developmental red flags that would be very visible moving in through adolescence. Some of the real barriers and the challenges that we faced are in constructing something that is going to assess for everything. It's going to capture all of the absolute needs of those children in our community, not only locally but globally, trying to be very sensitive in the development of this instrument, and trying to really target where the children are at. The effect of using the interRAI 0 to 3, certainly for individual children, it's going to change their pathway. And so we know that when you complete just assessments and don't move it forward in terms of understanding what's related by way of interventions, then that's where the disconnect lies. And if we can intervene throughout that entire lifespan, we know that's going to have a greater effect than a one-off assessment that may not have those effects. I think what is most game-changing about the construction and validation of the interRAI 0 to 3, it's in the long-term effects. So what we are really hoping for is to change the service sector so that it is streamlined, so that we have a common language among the assessments, so clinicians know what they are looking for. They know what services to refer these children to. Community partners are coming up to us and saying to us, we need an assessment that is going to really look at what children need in the community. And that's why we're here, and that's why we're looking for this support from the London Community Foundation. Thankfully, with their support, we're able to move it forward. We're able to validate this instrument and make sure that that age range from 0 to 3 that is most crucial for early intervention purposes is going to be targeted and get them the exact supports that they need.